My name is Lisa Kenney and I'm an athletic trainer from Multicare Orthopedics and Sports Medicine. Today we are going to talk about 3 different types of shin injuries and what you can do to prevent them. The first type of shin injury we're going to talk about is medial tibial stress syndrome, or MTSS. This typically affects the inside portion of the lower leg, the long bone of the shin, and starts anywhere from in the middle to down closer towards the ankle, more of a diffuse pain that can spread throughout that area. This typically comes from increasing mileage or adding intensity to your workouts over a period of time. Athletes will typically experience MTSS as their training loads increase. They're increasing mileage and increasing their intensity and activity. If properly managed, it can be manageable during the activity. Often it will require some more rest and further evaluation to alleviate some of that pain. The second type of shin injury that we'll be talking about is a stress fracture or stress reaction. So with a stress fracture or a stress reaction, an athlete will typically experience increased pain that is in a smaller area, more pinpoint directly on the bone. Often they will experience the pain during and after activity, and often will have trouble in advanced stages with weight bearing itself. Stress fractures and stress reactions are treated with rest. You typically can manage with using ice, using some stretching, but really rest is the best remedy for this type of an injury. The third type of shin injury that we'll discuss is chronic exertional compartment syndrome. When you're doing activity, including running, the body is funneling blood to the lower leg and the muscles to make sure those muscles are working properly. However, at times the tissue surrounding the muscles in the lower leg doesn't stretch or give as much as it needs to allow for the increased blood flow to the muscles. In that case, vessels and nerves can be compressed and you may get numbness or tingling into your foot during activity. The pain with chronic exertional compartment syndrome is different from the pain of a stress fracture or MTSS because there's more of that neurological sensation or circulatory sensation involved with the numbness and tingling. The pain has been described as being full and pressury in their lower leg as well. Now that we've talked about 3 different types of shin splints and lower leg injuries, here's a couple tips for helping to manage and prevent them on your own. Starting with wearing good shoes. So especially if you're getting into running, wearing a good running shoe is very important, properly fitted with a good arch support, and that can be done at a running store where somebody can help make sure that you are properly outfitted for starting to run. Another way to help prevent some of these injuries is to slowly increase your activity. So especially if you're new to running, make sure you use a program to ramp up your running at an appropriate pace. So something like a couch to 5K program or something like that can give you some good guidance on how to increase your mileage without going too much too fast. And finally, making sure you get a good warm up before your activity, whether it's running or anything else, including some very easy stretches that you can do on your own to make sure your quads and hamstrings and calves and muscles of your lower leg are all loose and ready for activity. First off would be a calf stretch. So just leaning back into it and getting a good stretch through the back of your lower leg. And you can also bend your knee a little bit to increase that stretch. You can hold those from 10 to 20 seconds as comfortable for you. Moving on to a quad stretch to stretch the front of your thigh. Grab your foot, pull into that, make sure your knee is pointing straight towards the ground. Last, do a hamstring stretch to make sure the back of your thigh is nice and loose. Some people aren't always able to reach their toes, and so reach as far as you can into a comfortable stretch. Shin splints and lower leg pain with activity are preventable and treatable, starting with making sure you're wearing good shoes, warming up, using proper stretching prior to activity, and then making sure that you are increasing your activity at an appropriate pace and not going too much too soon. If you have any questions about your individual treatment plan, because each person recovers differently, please come see us at Multicare.